Today we're going to talk about our first session for understanding the health system. And in this series, there are 5 topics. The first is the fundamentals of a healthcare system, and sometimes some of these things you'll already know, and so we might go through them quickly, but please feel free to ask any questions as we go along. And so there's a series, this is the caregiver series. There's also a series for people with IDD as well that will be on a different recording. All right, let's see if I can get my slides to work. Okay. So this learning series will help people with intellectual and developmental disabilities and their caregivers learn to use the healthcare system. And the reason we think this is so important is we want to keep ourselves and the people we love healthy, and we want to know how the best ways to get the things that we need and how to be heard when we're navigating our doctor's visits, our insurance companies, all of that. So there are 5 sessions. There's the fundamentals, and that's what we're doing right now. There's 2 is session 2 will cover loved ones' rights. So someone with IDD's rights within the healthcare system. Session 3 will be all about supporting self-advocacy and the person you help care for. Session 4 is about where and when to seek care. And session 5 is all about going to the doctor. And there are 2 versions of every session. So there's one for caregivers and one for athletes as well. And most of these sessions will last about an hour. So the first thing we're going to start with is just to talk about some common terminology. Most of these things probably everyone is aware of, but let's just talk about them to make sure we're on the same page. So we have four major terms: health, healthcare, health literacy, and self-advocacy. And we talk about health as being physical, mental, and a social, emotional well-being. And healthcare are the services that help improve our health and maintain our health. And health literacy is knowing how to find and understand the services that we can access to stay healthy and how to digest that information so that we're leveraging that in the best way possible. And then self-advocacy is being able to express yourself about the things that are important to you. So this is something we really encourage people with IDD, and they should be empowered to advocate for their own needs whenever possible, whether you're supporting a minor or your child or a sibling or just someone else that is in your life. As a caregiver, it's our role to support self-advocacy, and we'll get into that a lot deeper in session 3. So there are different types of care, and we're not going to read this slide word for word. Most of us are familiar with preventative care, primary care, acute care, rehabilitation. There's ongoing treatment and management, long-term care, which covers nursing facilities, respite care, day programs, things like that, home health. And then there's end-of-life care. I do want to touch upon under end-of-life care, we have palliative care and hospice care. And I just really want to point out that palliative care is not necessarily end-of-life care. If you have someone in your life who is having long-term illness or chronic illness, palliative care can be a great tool to help oversee and manage all of the specialties that you are accessing and help to do med management and really make their quality of life the best that it can be. So I think sometimes palliative care is a scary word for people, but it is not necessarily end-of-life care, even though it is often grouped into that category. So, and these are some different types of appointments that people might have, and there are fairly broad categories here, but these are the most common types of appointments that most of us go to the doctor for. We have routine visit appointments like your annual checkup, your wellness exam, any preventative health like teeth cleanings, and monitoring of chronic or reoccurring conditions. You might also get one of these to get clearance for school sports. The next one is an office visit, and this is the only difference in this, rather than your physical, is that it's an appointment you schedule when something comes up. So maybe you have a new symptom or a new pain or a new concern, or maybe you need a new medication. That's when you would go to do an office visit to address a new concern. And then vaccinations, lab tests, and blood works. And that's just when you go in for a quick in and out appointment to meet those needs. And then finally, something that's becoming way more common these days is a telehealth visit or a virtual visit. We've definitely seen an increase in these since COVID. And these, I think, can be a double-edged sword. They can be great for people who maybe can't access transportation, but there are some of us who really need that experience to be in person to get the most out of our appointments. And these are most often non-urgent appointments. And then here's just some example of different ways that we pay for our medical costs. So we have private insurance, which most of us get through jobs, or our minor children are on our insurance. And we all know the healthcare isn't cheap and is getting more expensive all the time. But for folks with disabilities, there's a few more programs that are to make things more manageable. And those would be Medicaid and Medicare. So you can have both private insurance and, in the state of Maine, Medicaid, which is Maine Care, that will pick up costs for you if you have a disability. And Medicare as a secondary or a primary payer or a secondary payer, depending on the type of Medicare plan that you have. But as most of you know, usually private insurance is provided through an employer or purchased directly by individuals and families. The insured person pays a monthly fee, which is also known as a premium. They may be also responsible for additional fees, including co-pays, co-insurance, prescriptions, deductibles, and more. And those are known as our out-of-pocket costs. And they vary depending on the type of insurance you have. And the tricky thing for people with IDD is because it can be so difficult for people to have a job, and especially have a job with full benefits. So unless that person is covered on a family member's plan, they're going to need another option. And that's where Medicaid comes in. And in Maine, Medicaid is Maine Care. Medicaid is a joint federal and state government program that gives health coverage to eligible people who have low income, including people with disabilities. Eligibility requirements are different from state to state, but most people covered by Medicaid do not pay premiums or co-pays, although sometimes there might be other minimal fees. And in the state of Maine, most individuals with IDD also qualify for Medicare as an adult, and Medicare typically is your primary pay, and then Maine Care comes in as your secondary pay. However, if you do a Medicare Advantage plan, then Maine Care stays your primary payer usually, and Medicare then picks up your as your secondary pay. And you might be wondering, if there's a certain age, you might be needing Medicare. And so in the federal program for anyone age 65 or older, but also for some people under 65 if they have certain disabilities or conditions. And there are two parts to Medicare. There's Part A, which is hospital insurance, and most people do not have to pay for Part A, and Part B is medical insurance. And most people pay a monthly part for Part B. In the state of Maine, that monthly pay for someone with IDD is not existent. And then there's also private pay as an option where you can pay for services out of pockets. However, this is extremely cost prohibitive, and most people cannot afford to do that. So a little bit more about Medicaid and Maine Care. It's super relevant for people with disabilities. Medicaid covers all medical services for people under the age of 21 who are members. And it helps pay for doctor's visits, medications, hospital stays, nursing homes, home health care, medical equipment and supplies, and transportation to and from medical services. It's also extra important for people with disabilities because it pays for home and community-based services. So it's helping pay for those BHPs, those PSSs, and those other services that are in home and getting your loved one out into the community. If you are under 21 and you are thinking, I don't think my child with disability would be eligible because I make too much money or we have a primary insurance, if you are unfamiliar with it, the Katie Beckett program is what we use here in Maine, and that does not take your income into consideration. It only takes your child's disability status and some other eligibility factors in when determining that eligibility. And so most people qualify for Katie Beckett. So your private insurance, if your child is a minor, your loved one is a minor, stays as their primary, and Katie Beckett then pays their secondary. And so it takes away those copays and some of those medical equipment that might have a significant cost to you, even if it's partially covered by insurance. And in the state of Maine, MaineCare, especially if you're under 21, will cover dental care, physical therapy, occupational and speech therapy, and mental health care for individuals. Respite care is mostly done through home health services. And we do, in the state of Maine, we currently don't have a lot of respite care facilities that will do long-term respite care, but it is possible. There are a few that exist. And so the coolest part about Medicaid as it applies for people with disabilities is that Medicaid can pay for home and community-based services. So once you age out of the pediatric services for MaineCare, as an adult, most of people with IDD will qualify for either a waiver 29 or waiver 21. Waiver 29 is what is often referred to as the smaller waiver. And that just means it's for people who are a little bit more independent, and it provides community-based supports, things like day hab programs, things like BHP services, transportation, and things like that. And then waiver 21, which a lot of people refer to as the big waiver, it does have a cap on it for 3,000 people, and you have to have certain eligibility requirements to receive that waiver. Everyone gets waiver 29 past the age of 21. Waiver 21 is a little bit more difficult to get. You have to meet a medical requirement, and you have to have a higher level of care. And we do have some documents that we will be linked under this video that you can check out for things about Medicaid and those waivers. And then as well, there'll be a workbook that goes along with these slides. So talking about some other services, your local state agencies may be able to help find out if you qualify, or you or your loved one qualify for other state-run services. And so the way to look into that best is to go through your case manager. And if you don't have a case manager, there on the Department of Human Health and Services, there is a list of case management services that you can contact and get a referral to set up those services. But that's really who's going to help walk through all of these, through getting things like those waivers and the home health things. And we'll also help you get SSI, which is Supplemental Security Income. And SSI provides monthly payments to people with disabilities and older adults who have little or no income or resources. And part of this, though, I do want to mention is that you do need to have a documented diagnosis to get these services. So sometimes that can be a sore spot for people who maybe don't want that written down on paper, or maybe aren't ready to get that in writing, but it is integral to get these services for your loved one, as well as it's super important for schools because it can influence the type of support you get and receive as part of your IEP. And it's also super important as an adult because that's how we get people services is by proving that they qualify for these services through their diagnosis. I've heard some caregivers express doubt about this from time to time, especially when their child is small. And I think we can all understand and empathize with that fear that someone with IDD will be stigmatized due to their diagnosis, which means they'll get, put into stereotypes or boxes, and limitations will be placed on them. While those are super valid concerns, there's a whole nother side to this, and that is having a documented diagnosis will allow your loved one to access services, funding, therapy, support, and so much more. So it's something to really think about, and especially for people whose disabilities might be a little less visible or noticeable to outsiders, and who might have to advocate more for their needs in order to have them taken seriously. And having the right language and documentation can really open doors for someone with IDD, and it's much harder to get formal diagnoses after someone turns 21 and transitions to adult services. So here are just some basic examples of insurance cards, and I'm sure most people are familiar with these. This is an Aetna insurance card. So you have your member and subscriber name, your member ID, your primary care providers listed. You have other providers often are listed on your insurance card, your group ID number, your out-of-pocket costs. your prescription cover info, and your date of birth. And this is great. We will also be doing this in the athlete section and really helping them navigate how to read a insurance card and utilize that. And so the next thing we're going to talk about is there are many different points of view, which are often referred to as models, and that's how we view disability. And there are two models that are super relevant to navigating the health system. And the first one is medical model, and the other one is the social model of disability. In the medical model of disability, it's viewed as a health condition that should be addressed by medical professionals. Disability is often considered a defect or abnormality that occurs within an individual in this model, and disability is seen as a problem, and the solution is to cure it or fix it or normalize the person. The social model of disability says that disability is just one aspect of a person's identity, similar to race, ethnicity, or gender. A distinction is made between a person's impairment and their disability. So an impairment is a medical term describing a loss of structure or function in someone's mind or body. A disability is the loss or limitation of the opportunities to participate in society equally due to social barriers and environmental barriers. In the social model, the problem is not the person, but rather the inaccessible environment or society that we live in. And so the solution is to create more inclusive, accessible systems and outcomes and environments. And so many disability scholars, activists, and self-advocates are critical of the medical model of disability. They say the social model is a better reflection of their own experience. And so one thing that we'll talk about in self-advocacy is really helping people who are in the medical world and approaching it as a medical model to understand the social model so that we can meet in the middle and have the best outcomes for our loved ones. And this is an example of some systems that can make things easier for people. So this is the curb cut effect. And this states that when you design systems and environments for people with disabilities, you make things better and more accessible for everyone. Small ramps cut into sidewalk curbs were originally designed to allow wheelchair users to move freely through the city streets. Once curb cuts became more widely implemented, people quickly realized that the curb cut benefited not just wheelchair users, but parents pushing children in strollers, travelers wheeling suitcases, delivery people using hand carts, anyone using a mobility aid, bicyclists, skateboarders, and more. Everyone benefits from a more accessible built environment. You can look deeper into this in your own time if you'd like. The disability justice movement bloomed in the 70s, notably in Berkeley, California, and Denver, Colorado. If you've ever seen the documentary called Crip Camp, that really talks about this kind of rise for disability rights. There's some really cool stories about wheelchair users smashing up curbs with sledgehammers when city officials refused to make accessibility a priority. There's also another great documentary called The Gang of 19 about the struggle to get an accessible bus fleet in Denver, and you can watch that on YouTube. It's called The Gang of 19. We don't have time to do as deep of a dive as I would like to, but these are some really cool things and can be really empowering for us as caregivers and for our loved ones to kind of see how the revolution of accessibility and disability rights happened. And before we move on, I just want to lift up one more example of inclusive design benefiting everyone. Closed captioning is a great example of this. Closed captioning is a visual text representation representing any spoken dialogue, music, or sounds on TV and videos, and it was invented as an accommodation for people who are deaf to help make sure they could stay informed and follow stories on TV. But a lot of us do that now if we're watching something on Netflix or Hulu, just because we might not be able to pick up on the dialogue as quickly or anything like that. So it helps everyone. All right, so now we're going to talk about some common challenges with disability in the healthcare field. There's some really heartbreaking statistics to illustrate the severity of the problem that people with IDD face when they are trying to get healthcare services. It's that people with IDD are 6 times more likely to die from preventable health conditions than the general population. That's a massive disparity, and Special Olympics and other organizations are working all over the world are committed to bringing that number down. That's part of why we're here doing this work. That's why we hold these educational opportunities. That's why we post these videos. That's why I go in and talk to healthcare providers and healthcare professional students to kind of educate them on these disparities. And we want to prepare ourselves to use the healthcare system So we can do everything in our power to get good care. We also want the medical community to change. We want the culture to be better than it is now, and the culture is changing, and a lot of health institutions are starting to recognize the severity of this problem. We're seeing a rise in disability trainings and other initiatives, but the type of change can be slow, and so we have to stay vigilant while this change is taking place. And one issue that can sometimes make it difficult to get good care is an issue called diagnostic overshadowing. And this is when a healthcare professional assumes that a patient's complaint or injury is due to their disability rather than fully exploring the cause of a patient's system. And this approach is often unintentional, but it can lead to delays or lack of treatment. And one story I always tell related to this is I worked with a student who was nonverbal and in a wheelchair, and that student was suddenly started exhibiting self-injurious behavior. And we worked with a school psychologist, we worked with his family, we could not figure out what was going on. We asked the family to take him to his doctor, and his neurologist, unfortunately said to the family, this is just what people who are nonverbal, they get frustrated, and this is oftentimes what their behavior looks like. And as educators and people who had worked with them, we didn't think that was correct. And about a year later, after this individual had unfortunately detached one of his retinas from his self-injurious behaviors, the family was able to get him in to see an optometrist at that time, and he had cataracts. And so what actually was happening was he was having cataracts. He did not have the language to express that. And his way of showing us and expressing his fear when you have something floating in your eye was to unfortunately aggress against his head. And because he wasn't diagnosed appropriately, he detached one of his retinas. Once in his good eye, once those cataracts were taken care of, he stopped the behavior. So that's an extreme example. But I think that you can see milder example of this happening with your loved ones, probably if you really sat down and thought about it. Sometimes people might become aggressive, but they're also clutching their stomachs. So as a caregiver, oh, something's off. You go to the doctor and you describe the signs and symptoms that you observed, and the doctor is just saying, oh, this is typical of autism. That's just a behavior that a lot of people with autism have. It's nothing to worry about. It might be due to puberty. And as caregivers, we have to continue to say, no, I know my person really well, and I'm going to assume that you have good intentions, but that's not what is happening right now. And I think it's important that most providers have good intentions and believe what they're saying is accurate, but what we live in a culture where that it's kind of unspoken, given that the doctor is always right. But when it comes to people with IDD, that's not necessarily the case. So there just isn't enough training in medical environments or enough exposure to people with different medical, social, and behavioral needs for that to be true. And so medical professionals miss things, and it happens all the time. And so while we can't control every aspect of that world, we can know that diagnostic overshadowing is an issue, and we can trust ourselves, and we can feel when something is wrong and feel strong enough to advocate for it and be heard. And the next example on the slide is the transition age, or the cliff, as we sometimes call it. And this is when someone with IDD transitions from youth to adult services. In healthcare, there's a transition at that same time. People typically transition from pediatrics to adult healthcare model between the ages of 18 and 21. And I will say, in the state of Maine, it is a very harsh cliff to jump off of. The services are very different from what you receive in pediatric to what you receive in adult health. And while some of you may know that for people with IDD, this transition can be extremely difficult, we've heard from caregivers that it can be hard for adult providers who are trained to provide appropriate care to people with IDD. And so some adults with IDD end up staying with their pediatrician for years into their adulthood, which can have its own challenges. And so that is a barrier when you transition into adulthood, is finding a good provider, especially specialists who are familiar with IDD and will continue to provide quality care. And during this transition, youth may also lose access to some of those specialty services, such as occupational therapy, physical therapy, speech therapy. Some of their medical equipment may not be covered by their adult insurance, and other services that were covered by insurance or provided in schools are no longer there. There is some good news, though, and that is People all over the world are advocating for better treatment and care on individual and systematic levels, consistent pressure from the disability community, new funding sources and research, and a growing movement towards inclusion for all factors, indicating a brighter future for people with IDD. But we do want to be aware that there are some things we are going to have to fight for and push for, and working with the resources we have, such as community case management and other service providers that we're working with to kind of fight for the things that our loved ones need. So just take a moment to kind of reflect on what we've learned so far, write down any insights or questions that might have come up for you. And I know that last slide might have given you a lot to think about. And if you've already been through the transition into adulthood, you might fully understand it and be like, yeah, that's old hat for us. If it's something that's coming up for you, it may seem scary. Definitely feel free to reach out and ask any questions. I have a good network of parents who've been through it if you'd like to connect with them. We will just take a couple minutes to do that. All right. And I think, just on a side note, writing things down when we hear things that trigger anxiety can be really helpful to kind of like set it aside and allow ourselves to move on rather than continuing to worry about it all the time, because we just know we can't control all of these things. So we're going to talk about family health history. And that is the record of the disease and health conditions in your family. Even though we're all different, lots of our behaviors and experiences are similar, and it can help healthcare providers understand the bigger picture about what might be going on with our bodies. So families often share a common environment, which can mean exposure to factors in our physical surroundings that affect our health, a shared lifestyle, which includes behaviors like nutrition, exercise, other behaviors related to our health. I think of the example of we hear a lot about the Mediterranean diet and how good it is for people who are living in, areas like Italy and Greece, and how they tend to live longer than Americans who have a little bit more of a processed food diet. So that's just an example of, even though everyone is different in that area, they have a shared lifestyle that they're all partaking in. And in many cases, of course, families share genes, meaning someone could be predisposed to certain health conditions that run in their family and get passed down from one generation to the next. So I know as I age, I'm looking out for high blood pressure and high cholesterol because genetically on both sides, that's what my family has going on. So I'm making sure to tell those things with my healthcare provider. So all of these aspects are things your health provider will consider when asking about your family health history. So you can see that it's more than just biology. For people who are adopted or don't know that much about their biological relatives, that's totally okay. You'll share their environmental and lifestyle information with your provider, and then let them know whatever the circumstances are for your situation, and they'll work with you to come up with a care plan based on what you do know. And so another fundamental part of health is choosing a primary care provider. And so a PCP is a healthcare provider who practices general medicine, and they're usually your first stop for medical care. PCPs treat a wide range of issues and should help you coordinate your treatment if you need to see a specialist. And a PCP is also a great option to help you kind of, if you are seeing multiple specialists who are prescribing multiple medications, to kind of house that medication list in one place and make sure that somebody is checking that over to make sure there are no interactions and that things are working the way they should. Most PCPs are physicians, but they could also be nurse practitioners or PAs, which are physician's assistants as well. And in the state of Maine, nurse practitioners can actually have their own practice. And so it's very common to have a nurse practitioner as your primary care. In the US, we have the right to choose your own PCP. In your workbooks, you'll see a list, which are linked below this video. You will see a list of things you might want to think about when you're supporting your child or loved one in choosing their PCP. Some providers will be more experienced with disability than others, or you may have other considerations that are important to you. It's okay to ask to meet with someone before your child or loved one makes their decision. And I think not being afraid, a really important piece of this is not being afraid to say, hey, this isn't a good fit for us, we're going to try someone else, and not to worry about the doctor getting offended, because ultimately the most important part of this process is making sure that your loved one has the best quality healthcare that they can receive. And so here are just some example questions that you can ask the first time you meet with your loved one's PCP. Even if they already have a PCP, it's never too late to ask these questions, because maybe you've been going to them for a while and you find some things out, and that might change the way you think about them. And so there's what are the typical health issues for people with my child or loved one's diagnosis or disability? What are the major health issues we should be concerned about now? Are there any future health issues we may need to be aware of? And will my person's disability change over time? And these are questions that I would encourage you to ask more than once, because things like, what are the major health issues we should be concerned about right now? That's going to change over time. Just like someone without a disability, as we age, our health concerns change. And I think with a disability, that can be magnified as you age, what those health concerns you should be worried about are. And then this one is just decided we're going to talk about being a well-rounded human being and making sure we're taking care of our bodies and our mental health. So taking care of our bodies is a big part of getting healthy and staying strong. Being physically healthy is important because it gives us more time and capacity to enjoy our families, friends, and the activities that give our lives meaning. And this is really our philosophy here at Special Olympics, is we want people to be physically healthy so that they can enjoy their lives to their fullest. And that's what we promote through our sport. But it's not the only piece that keeps us healthy. There are other areas in our life that need attention too. So it's important to nurture mental health, relationships, including family and friends, cultural and spiritual practices, passions and pastimes, and making sure that the people that we care for are also nurturing those things and growing those things in their lives. We want to focus on the big picture of our well-being. We want to take a few moments to jot down the types of activities or circumstances that make you feel happy and healthy. And as caregivers, this is also really important, right? Like it's really stressful sometimes to be a caregiver. It can feel a little bit never ending. So it's really important to be able to find a few things that you can turn to help you de-stress, that make you feel healthy, that can be critical to your overall health. And we don't lose those things. So this is an activity, and you can check this out in the workbook if you'd like, but it's called pod mapping, and this will help each of you to determine who you can reach out to when you need support. And so one thing we hear a lot from caregivers for people with disabilities was they have a hard time asking for help. And many parents and other caregivers say they worry about being a burden on their friends or families, or maybe they feel like their situation is too different from what other people in their lives are experiencing and that no one will be able to relate to them. But everyone needs help, and not just some people. And life is much easier if we're connected to each other and part of a community. And sometimes the people around us even want to help, but they might not know how to help or what kind of help would be useful to you. So take a look. This is on page 20 of the workbook, and there's an example on page 21. And we'll look at this example together and make sure we understand everything. So there's a blank pod map on page 28 that you can fill out and put it up somewhere to kind of help you remind. So really what this is like kind of yourself is at the center. You have all of the different people in your life that you can reach out to, including, we have SO swim coach, you have your daughter's favorite teacher, we have the Special Olympics community, you have your parent-to-parent support group, the Down Syndrome Association parents group, parents of my child's friends, a church group, if that is something that you are so inclined. And then in that inner circle, you have immediate family and good friends that you can lean on as well. And you can kind of use this just as a reminder of who you have to help out with different things as they arise. And so last but not least, you're never too old for homework. There's nothing you need to turn in at the last session, but wrapping up for today, and the next 2 pages of your workbook include some preventative measures you can take home to improve your health and the health of anyone you help take care of. And so this is practice good hygiene, make sure your home is safe, take care of your body, and take care of your mind and heart. I encourage you to go over the list with the person you help care for. You might even be able to make a short checklist together about some changes you want to make to be more healthy as a family. And finally, we've got a list of common disability and medical acronyms in your workbook, as well as a space to write your own down if you need help remembering any. Um, and that's it. So thank you so much for watching, and we look forward to the next session.